This month's team brief comes from the emergency department at Heartlands Hospital, where fortuitously today is the day that the brand new resus department opens, and I'm going to have the honour of doing it live on Team Brief. There we go. I declare it open. Shortly I'm going to be interviewing Sue Dorian, who's a consultant in emergency medicine, and I'll be asking her what impact the changes in this department are going to have. Obviously the main headline for the Trust at the moment is first of all the financial problems that we're facing, and secondly the change of leadership. So what I want to do is to be clear about the background to this. As we've gone into more of a financial problem, our regulatory body, Monitor, has required strong new leadership to be brought into the organisation. And I'm very pleased to see that Dame Julie Moore and Jackie Smith, who are the Chief Executive and Chair respectively of UHB, are going to come in as the new leadership team here. Now, a couple of important points to make about this. First of all, in the situation that the Trust is in, it needs good, experienced, proven leaders. And Julie and Jackie are precisely that. Secondly, I know that some of you will have some concerns about working more closely with UHB because we've had a rivalry over the years between the two trusts. But the NHS is changing now. It's the old world was one of competition. Nowadays it's much more about collaboration. I've known Julie for many years, and one of the first things that I did as Chief Executive here was go to see her to start talking about how we could cooperate better between the two organisations. And there's a range of issues that we've agreed that are opportunities where both organisations can benefit. So this is obviously work that will be able to be carried forward under Julie's leadership. Moving on to the issue of quality, and we've had good news because of the latest information about the mortality index. This is something called HSMR, which measures the number of people who die in a hospital compared to those who are expected. And on all of the main measures we are below 100, which means that we are better than expected. Now you can see here from the MRSA chart, the position where we've had just one MRSA so far this year, and looking at the C. diff chart, you can see again that we continue our year-on-year improvement in always reducing the number of cases of C. diff. Finally, if you look at the number of major harms, unfortunately that has gone up for this month to a total of 42, and this is particularly because of a cluster of cases of E. coli. I'm delighted with the role that staff engagement has taken on the Trust in the last few months, and across the spring and summer we held 20 listening events which were attended by over 1,000 staff. And I'm delighted to hear that the new leadership team will be stressing their continuing commitment to staff engagement as a way of working. And finally, many of you will have been selected at random to participate in the National Staff Survey. Can I encourage those of you who have received this form to fill it in, and there is a central collection point that you can send it to, and to reward you, if you drop it off at the central point, you will get a Kit Kat. So please do fill in the form and tell us how you think we're doing as an employer. Here I am with Sue Dorian. Sue is a consultant in emergency medicine, and she's worked at Heartlands for the last 3.5 years, and she's one of the 2 clinical leads. So, Sue, what are the main changes that have taken place in the emergency department here?
So we've extended our floor space in order to be able to accommodate more patients easily. We've moved our minor injuries area across to the old fracture clinic area, developing some cubicle space for use for our GP and ED service, which delivers primary care-led services, and also for our emergency nurse practitioners, giving them space to be able to see and treat patients as quickly and efficiently as possible.
And what do you expect the impact of that to be?
Well, we moved across to minors in order to help us create more space within our majors area too. So we're expecting that we're going to be able to look at dealing with patients in a more efficient way. We've increased our assessment areas so that we can assist the ambulance service in being able to turn around patients within the first 15 minutes of their arrival. We've also increased our capacity for patients with the most critical illness by developing some high dependency area cubicles as well. So moving our minors area out of our majors area space has meant that we've got more capacity to accommodate the very sickest patients as quickly as possible.
So this will improve patient safety, is that right?
We're really hoping so. We're hoping that increasing the assessment areas will enable us to speedily assess and rapidly determine the most appropriate area for patients to be cared in, as well as actually having those facilities to do so in our high dependency areas.
Well, I'm delighted to hear that. ED has had a special place in my heart whilst I've been at Heartlands, and it's good to know that we're improving safety. Now, I've got 3 quiz questions for you.
Okay.
First one's an easy one. Approximately how many patients do we see in our emergency services a year?
So we see across the whole trust, so Heartlands and Good Hope emergency departments and Solihull minor injuries unit, we see approaching 250,000 patients a year, about 125,000 of those on the Heartlands site.
I see. And secondly, what's this charitable activity that you've been getting involved in the department?
Lots of charitable activities, but I think that you're probably mentioning the topless calendar that our male consultants have been participating in recently.
Right, and can we perhaps have a little sneak preview of that if possible?
Oh, we can try and find the images, yeah.
Okay. And then thirdly, and this is a really important question, if you were to have a sausage sandwich, would you have brown sauce on it, red sauce or no sauce at all?
It depends on the time of day. At
You're not allowed to
breakfast
say that.
time, yeah, at breakfast time, no sauce.
Yep.
But if it's later on in the day, then barbecue smoky sauce.
Well, there you go. There's a novel answer. Okay, and I want to now sign off by saying goodbye to everybody in HEF. Best wishes for the future. This is a great organisation with some wonderful people and some great teams, and I'm confident that you'll go on to great things and be back to where you were, one of the best trusts in the country. Thank you, everybody.